What are lymph nodes, and how do they relate to lymphoma? Imagine tiny bean-shaped structures scattered throughout your body that act like checkpoints for your immune system. These are your lymph nodes, small but mighty organs that filter lymph, the clear fluid that travels through your lymphatic system. Lymph nodes are found in areas like your neck, armpits, groin, and inside your chest and abdomen. They contain immune cells such as B cells, T cells, macrophages, and dendritic cells, which work together to identify and fight off infections, damaged cells, and foreign substances. Each lymph node is enclosed in a tough capsule made of connective tissue. Inside, lymph flows through different regions: the cortex, paracortex, and medulla. The cortex has lymphoid nodules filled with B cells, which produce antibodies. The paracortex is where T cells, vital for cell-mediated immunity, are concentrated. The medulla contains cords and sinuses filled with plasma cells and other immune cells. When lymph enters the node through small vessels called afferent lymphatic vessels, it passes through these regions, allowing immune cells to scan for troublemakers. The main job of lymph nodes is to serve as surveillance stations. They monitor the lymph for signs of infection or abnormal cells. When they detect something suspicious, they activate immune responses, producing more immune cells to fight off invaders. This process is crucial for keeping us healthy and responding quickly to threats. Now, how does this connect to lymphoma? Lymphoma is a cancer that starts in the lymphocytes, which are the white blood cells residing mainly in lymph nodes. In non-Hodgkin lymphoma, these lymphocytes grow abnormally and uncontrollably. This can cause lymph nodes to swell, often noticeable as lumps under the skin, especially in the neck, armpits, or groin. Because lymph nodes are part of the immune system's network, when lymphoma develops there, it can spread to other lymph nodes or organs like the spleen and thymus, which are also part of the lymphatic and immune systems. Understanding the structure and function of lymph nodes helps us grasp how lymphoma forms and progresses. When abnormal lymphocytes multiply within these nodes, they can form tumors that disrupt normal immune functions. Detecting swollen lymph nodes is often one of the first signs that lead to diagnosis. Doctors use imaging tests and biopsies to determine if the swelling is due to lymphoma or other causes like infections. The spleen and thymus are also important organs in the lymphatic system. The spleen filters blood and helps fight infections, while the thymus is where T cells mature. Both can be involved in lymphoma, especially as the disease advances. Treatment strategies often target these abnormal lymphocytes within lymph nodes and other affected tissues to control the disease. In summary, lymph nodes are vital for immune defense, acting as filters and communication hubs. When lymphocytes become cancerous, as in lymphoma, these nodes can enlarge and form tumors, impairing immune function. Recognizing the signs and understanding how lymph nodes work is essential for early detection and effective treatment. Always consult healthcare professionals for personalized advice and diagnosis, as each case can be quite different.